Hello guys, I hope all of you are doing well. I'm Dr. Ranjan, your pharmacology faculty at Mero. And guys, this is a special session with respect to INI-CET. All of you guys, you have requested me to conduct a session on the new drugs of 2023 for the upcoming INI-CET exam. So in this session, guys, I'll be discussing all the new drugs, not only of 2023, but also some of 2022. So by combining all the new drugs of these 2 years, I've made this session where I'll discuss only the relevant drugs which are important, because you see, tons of drugs are approved every year, but every drug is not important for the exam. So I've selected few drugs which are important in this year and last year, and I've tried to make this session wholesome by doing what? By pitting the new drugs against the older drugs which are already there in those diseases, and we'll compare how these new drugs they fit in to the already existing drugs. So we'll do that. Second, for some new drugs, I've made some MCQs as well to sort of spice up things so that you can get an idea of how these new drugs can be used to make an MCQ as well, right? Uh, there are two new drugs which I'll be discussing, which are the first ever drug to be approved for those diseases, and those are very important ones. So I'll begin with those drugs. Then we will look at other drugs which are addition to the already existing drugs for those diseases in those classes. So guys, let us not waste any time and dive right into in this session. As I have said, I'll discuss not only new drugs but some probable MCQs which are related, which could be asked in the exam. So look at the first MCQ, guys. All of the following statements are true regarding Rett syndrome, except, right? So if you remember, in the last INI-CET, there has been an MCQ on new drug, right? Some made an MCQ around that. Option A, tofersen is the only available drug for treatment. Option B, only females are involved. Option C, deceleration of the head growth is the first sign. And option D, is a neurodevelopmental disorder. So what do you think is the answer? Right. Now, if you know the answer, do let me know in the comment box. If you don't know the answer, let us get down to the answer here. Guys, the answer is option A. Now, tofersen is indeed another new drug approved in 2023 itself, this year, but not for Rett syndrome, for something else, which we'll discuss in a short while. So, it's not tofersen. Now, coming to the new drugs, the new drug that has been approved is trofinetide, and trofinetide was asked in the last INI-CET, which is a new drug approved for treatment of Rett syndrome. So in this page of new drugs, I'll be discussing two drugs in 2023, which are the first ever. These are the first ever approved drugs for this disease. So Friedreich's ataxia and Rett syndrome, there were no drugs before this. So Rett syndrome, trofinetide, its mechanism of action is unknown. Now see, from this mechanism, from the name itself, what can we learn? Is a tide, is a peptide, and from this peptide DE, we can learn one thing: deceleration of head growth. It is the first sign, right? NE is a neurodevelopmental disorder. And FI, we can remember, FI means females. Only females are involved. So from the name of this drug trofinetide, we can learn at least few things. Because see, once they introduce you to a new drug for a disease, the introduction is over. Then what they ask is about something else about the drug and the disease itself. So this is what we can learn about trofinetide. Coming to another drug here, Friedreich's ataxia is the only drug available for treatment of Friedreich's ataxia, and that too for age group more than 16. We have the data, and the drug is called as omaveloxolone. Now, omaveloxolone, it is an antioxidant drug, and if I have a hunch that they might ask in the next INI-CET, if you ask me, sir, which new drugs, so I'll discuss a bunch of new drugs today. And if you ask me, sir, which has the highest probability of being asked, is omaveloxolone. The reason being, whenever a first ever drug is approved for a disease, it has the highest probability of being asked, right? And what can I learn from this name of this drug? Say, number one, what can be seen in case of Friedreich's ataxia? A for, there would be obviously ataxia, M for myopathy, and that is cardiomyopathy. and O for there is optic atrophy can be seen. So these are 3 points about Friedreich's ataxia which are present, which I can learn from this drug. So guys, these are 2 drugs, and these 2 are important drugs. One has been asked, one might be asked. Now moving on to other new drugs. So see, these are the first ever approved drugs in these classes. Now the new drugs which I'll discuss, they're addition to the already existing drugs for those diseases. And again, I'll begin with one MCQ here. Which of the following drug is used for treatment of ALS, amyotrophic lateral sclerosis, with SOD1 gene mutation? SOD, I hope all of you know, it is superoxide dismutase 1 gene mutation. Right, that is increased production of free radicals, that is superoxide dismutase, and that can result in ALS. Right, so look at the option A, Reducol, B, edaravone, C, SPT is sodium phenyl butyrate, taurursodiol, D for tofersen, right? So what is the answer here? All right, so even if you don't know the answer, obviously these are new drugs, you might not know the answer. The answer is tofersen here. And if you remember the first question I discussed, tofersen is not approved for Rett syndrome. Rather, tofersen is a new drug approved for ALS where there is SOD1 gene mutation, right? So in today's new drug session, what I'll do is I'll not only talk about the new drug, I'll talk about the new drugs in green color, right? I'll talk about the new drugs in green color. Apart from that, the other drugs available I'll cover in red color so that I can give you a holistic understanding of the new drugs in that topic. Now, so neurodegenerative disorders, ALS, amyotrophic lateral sclerosis. See, the drug of choice is Riluzole, right? Drug of choice is Riluzole. If the patient does not respond to Riluzole, I can use edaravone, which is a free radical scavenger. I can use sodium phenyl butyrate taurursodiol. It was approved last year, right? Tofersen has been approved. So this or this can be used in case the patient does not respond to Riluzole. What is the use of tofersen? Tofersen has been approved this year. And tofersen, it is an, see, from SEN, what is this drug? It is an antisense oligonucleotide. It is an antisense oligonucleotide. So that is SEN, right? Antisense oligonucleotide, which what it does, it breaks the mRNA of SOD1. So if there is SOD1 overproduction, I'll break down the mRNA. That will decrease the production of SOD1. So that is what the MCQ asked. ALS, amyotrophic lateral sclerosis with SOD1 gene mutation, which drug can be used? Your answer here, your answer was tofersen, right? So tofersen has been specifically approved for this indication, right? Now coming to the other new drug, sodium phenyl butyrate. See here, there are 2 components, sodium phenyl butyrate and taurursodiol. Sodium phenyl butyrate, it is a blocker of histone deacetylase enzyme, whereas taurursodiol, it blocks apoptosis of neurons. So it is an anti-apoptotic drug, right? So there are 2 new drugs in ALS, and remember, neurodegenerative disorders. Neurodegenerative disorders, they are important. They will ask MCQs on neurodegeneration. The reason being, we don't have many drugs, so to say, disease-modifying drugs in these disorders. So Alzheimer's, Parkinson's, ALS, whenever there are new drugs, they will ask, right? Now moving on quickly to the next one. Again here, before I move on to the next drug, let us solve a small MCQ. Which of the following MAB can be used in Alzheimer's disease, right? So there are 2 new MABs, and look at these options: erenumab, fremanezumab, galcanezumab, lecanemab. Now, if, first of all, to begin with, if before MAB, if you have N or NE, so N or NE, it stands for neurology, right? Neurology, which means what? For any disease from the central nervous system, if I'm using a drug like Alzheimer's or migraine, the drugs will have N or NE. All right, so what is the answer here? If you know, let me know in the comment box. If you don't know, it is fine. This session is not to test you. Just to spice up things, I've given the MCQs here, right guys? So answer here is lecanemab. Now see, again, let me tell you a little bit about Alzheimer's disease quickly. See, mild cases or moderate to severe cases, both the drug of choice is donepezil. Moderate to severe cases, if the patient does not respond, we add another drug called as memantine. Right? One thing they can ask you, which is the only drug that can delay the process of neurodegeneration, that is memantine. Remember, donepezil has no effect whatsoever on neurodegeneration. It has only symptomatic benefit. That is how it acts by increasing acetylcholine. Now, coming to these two new drugs, aducanumab and lecanemab. These are two new drugs for Alzheimer's. And how can I remember? See, one I told you, if these are drugs from nervous system, and see, these are blockers of beta amyloid, and to use these drugs in Alzheimer's, first of all, they're effective or they're used only in mild disease. That is the reason I've written them below mild. Plus, I must do an MRI that could confirm the presence of beta amyloid plaques. Otherwise, there is no point of using these two drugs. Now, coming for exam, how to remember these two drugs are there. Now, see, I told you there has to be N or NE. So there is NE and N. Now, drugs in Alzheimer's, look at the first two alphabets, A and L. So A and L. So A and L drugs with NE, these are for Alzheimer's, aducanumab and lecanemab. So this is much simple now to remember. There is no other drug starting with A or L. So all other drugs here, for example, if I go back here, all the other drugs, these are approved for treatment of migraine. These are anti-migraine drugs. So again, neurology, but not Alzheimer's, right? So now moving on to some new drugs in psychiatry. Psychiatric disorders, guys, postpartum depression. In a patient of postpartum depression, the first treatment is always psychotherapy. And if psychotherapy does not work, or we want to use drugs with psychotherapy, the first line drugs are just like for any other depression, that is SSRI, SNRI, mirtazapine, etc. Right? Now, whenever there is an inadequate response to first line, or there are severe cases of depression, in this case, what can we do? So we have a filler here, and these are drugs like brexanolone and zuranolone. Brexanolone was approved, 2-3 years back. Zuranolone has been approved in 2023. So both these drugs, the only difference is one is IV, one is oral, and both these drugs, their mechanism of action primarily is by GABA A receptor agonism. So these are GABA A receptor modulators which can be used in postpartum depression, right? Now, I'll discuss the next new drug, but before that new drug, I've just thrown one MCQ here, right? Which of the following mechanism is not associated with antidepressant effect, right? Now look at this. Option A, 5-HT2 block. Option B, increased 5-HT or serotonin. Option C, 5-HT1A block. And option D, increased dopamine. What do you think is the answer? If you know the answer, let me know in the comment box. If you don't know the answer, it's okay, it's fine. The answer here is option C, 5-HT1A block. So antidepressant effect is not seen because of block, rather stimulation of 5-HT1A, right? Anyways, so why did I ask this MCQ? So that I can teach you about a new drug approved in 2023 for depression. See, major depression, what are the atypical drugs? Let me recap it faster. 5-HT2 blocker like mirtazapine is the first line drug. Drug increasing dopamine, to some extent norepinephrine, it is bupropion. Melatonin agonist like agomelatine. Novel drugs like vilazodone and vortioxetine, which are SSRI as well as 5-HT1 agonist. Plus vortioxetine, it also has many others, receptors, agonism, antagonism, like it also stimulates and blocks other serotonin receptors. 5-HT1A agonist, gepirone, so green color. So this is the drug which has been approved this year for treatment of depression. Now, gepirone is a 5-HT1A agonist, ONA, 1A agonist, and usually 5-HT1A agonists, these are anxiolytics, right? These are anxiolytics. And this is the first 5-HT1 agonist which has been actually approved by FDA for treatment of depression, gepirone, right? So, gepirone, remember, is a 5-HT1 agonist. Now, going back to the MCQ, I told you which mechanism is not associated with antidepressant effect. Your answer is 5-HT1A block. So, just to spice up things, as I said, I made this MCQ, right? Now, here, 2 points I would just like to reiterate so that it might be asked in your exam. Mirtazapine, all of you know, is called as a NASA drug, whereas vortioxetine is called as a MASA drug. So NASA noradrenergic specific serotonergic antidepressant. MASA is multiple serotonin agonist and antagonist antidepressant. Your answer is vortioxetine. These are novel drugs, right? Novel drugs. All right. Now, before I move on to the next two new drugs, for those two new drugs, I made one MCQ. Which of the following drug is not used in vaginal candidiasis? Right? Fluconazole, oteseconazole, ibrexafungerp, rezafungin. What do you think is the answer, guys? Come on. If you know what is the answer, you can let me know in the comment box. If you don't know, let me tell you what is the answer. Your answer is rezafungin. Now see, rezafungin, if I look at candidiasis, for vaginal candidiasis, all of you know the drug of choice is fluconazole. Two new drugs are oteseconazole and ibrexafungerp. Oteseconazole is an azole. Ibrexafungerp, it's as well as echinocandins, both are inhibitors of beta glucan synthesis, right? The difference is ibrexafungerp is an oral drug, echinocandins are IV drugs, right? So two new drugs we learned here. Oteseconazole is an azole, ibrexafungerp is a beta glucan synthesis inhibitor. And if I talk about these two drugs, oteseconazole and ibrexafungerp, what is the role in vaginal candidiasis? See, fluconazole is the drug of choice, right? Both these drugs, we use them for recurrent vulvovaginal candidiasis. RVVC is recurrent vulvovaginal candidiasis. We use oteseconazole, ibrexafungerp. Any one of these two can be used. So if I'm using fluconazole for 2 times, 3 times, and the female is still recurring, in that case, I'm going to use either oteseconazole or ibrexafungerp. Echinocandins, guys, all of you know these drugs, all of them, they end with fungin, caspofungin, micafungin, anidulafungin. These are the drug of choice for invasive candidiasis or candidemia, right? Now, the latest addition to this class is rezafungin. So it also ends with fungin. So if I don't remember, it's okay. If I don't remember all the names of the drugs, it's okay. At least I should remember any drug ending with fungin is a echinocandin, right? And these are the drug of choice for invasive candidiasis or candidemia. So if there is blood infection, right, caused by candida, or candida causing meningitis, or candida causing any other infection of your systemic organs, your preferred drug would be an echinocandin. All right, oral candidiasis. This was recently asked. Oral candidiasis, drug of choice is clotrimazole because I can use it as lozenge, so the local effect is more better. So I've just recapped treatment of candidiasis, and I've told you what is the use of the recent new drugs. So we discussed 3 classes of new drugs here. All right, in antimicrobial drugs, there is a new drug here for Demodex blepharitis. Now for Demodex blepharitis, that new drug is lotilaner eye drop, and it is an anti-parasitic drug, right? It is an anti-protozoal or anti-parasitic drug. What else I do use here? See, I can use tea tree oil or tea tree shampoo can be used, traditional method, or I can use oral ivermectin. So the first ever eye drop is lotilaner eye drop, and it is anti-parasitic drug. So this might be asked because this is the first ever eye drop for treatment of Demodex blepharitis. So this is one MCQ which might go into ophthalmology, but since it is a drug I'm covering in this session, right? Now, before I move on to the next new drug, let us have a look at an MCQ from that new drug. Which of the following is a new drug approved for RSV prophylaxis, right? So this MCQ has been asked once, right? But can you find the answer? Now, it's not a repeat, right? PYQ. Nirsevimab, pembrolizumab, retifanlimab, baloxavir. Right. So if you don't know anything, anyone would go for a wild guess with Valoxavir. That would be a wrong answer. It's an anti-influenza drug. Because of vir, you might get confused. So obviously this is not the answer. See, whenever a drug ends with mab, I have to look what lies before that. If there is Li, it means lymphocytes. If it is Vi, it means virus. So it's again Nirsevimab is against virus, and against which virus? Against RSV. So nirsevimab, you can see here, nirsevimab is a mab against virus, and against which virus? RSV, right? So it's easy to learn from this name. All right, the earlier MCQ which has already been asked in your AIMS exam was palivizumab has been asked. They asked you which of the following drug can be used for prophylaxis of RSV, palivizumab. So RSV, guys, treatment drug of choice is inhalational ribavirin. Prophylaxis, in infants, we can use either palivizumab or nirsevimab. These are two drugs, they end with V. So if you don't know anything, always try to see what is before mab. It is VI, it means virus, right? All right. Now, coming to one new drug for treatment of post-menopausal hot flashes. So post-menopausal hot flashes, first of all, let me summarize what are the options we have. The first line drugs in post-menopausal hot flashes are obviously estrogen replacement therapy, that is HRT. Second line drugs, we can use SSRIs. Specifically, if the patient is also depressive, I can go for SSRI. Suppose the patient has neuropathy or the patient has insomnia, then I'll not go for SSRI. I can go for gabapentin because it will cause drowsiness and it will help in insomnia and neuropathy as well. So these drugs I know, right? Now coming to today's new drug, fezolinetant. Fezolinetant is a neurokinin 3 receptor antagonist. Now how to decode this drug? Let us do Sandhi Vichhed of this drug. A and T means antagonist, right? T means T for 3, THREE, and NE means neurokinin. So it's a neurokinin 3 antagonist, which is used for post-menopausal hot flashes. Where is it used? It is used in females, right? So it is used in females, neurokinin 3 receptor antagonist. All right, now moving on. Which of the following drug blocks absorption of glucose both in small intestine and kidney? So with respect to another new drug of 2023, I have made an MCQ. Let us try to solve it, even if I don't know the answer, right? Look at the options A, B, C, D: acarbose, canagliflozin, tirzepatide, and sotagliflozin. So guys, what do you think is the answer here? Acarbose, canagliflozin, tirzepatide, and sotagliflozin. Now, even if you don't know the answer, it's okay. The answer is sotagliflozin because it is the first in class SGLT1 and 2 blocker. 2 is present in kidney renal tubules, 1 is present in small intestine. So by blocking 1 and 2, it can prevent absorption of glucose both in small intestine as well as kidney. Right? Sotagliflozin, it has been approved in chronic CHF to decrease mortality. It has been approved in patient of diabetes mellitus and CKD to decrease CVS mortality. So I've taught you this, a decrease in mortality, anti-diabetic drugs, decrease in mortality is seen with GLP-1 agonist, it is seen with SGLT2 blockers, plus even metformin can decrease mortality. And that is CVS mortality. So drugs which can decrease CVS mortality, GLP-1 agonist, SGLT2 blockers, metformin. So these are the specific indications of this drug. Another new drug, it is a dual GIP, gastric inhibitory peptide, and GLP-1 receptor agonist. It is called as tirzepatide, and it has been approved for type 2 diabetes mellitus. It is a peptide which can be given by subcutaneous route, right? All right. Now moving on to another new drug for myasthenia gravis for chronic immunosuppressive therapy. So see, for myasthenia gravis, for symptomatic relief, I do use pyridostigmine, right? Now pyridostigmine, how does it act? By increasing acetylcholine, it will displace the antibodies. But can I decrease the a number of antibodies as well? I can do that. How? The older drug is ravulizumab. It is a complement 5 blocker which is used usually in PNH, paroxysmal nocturnal hemoglobinuria, but it has also been approved for treatment of myasthenia gravis for chronic immunosuppressive therapy. A new drug has been added to this list in 2023, rozanolixizumab. Now see, rozanolixizumab, this is a drug, it's a mAb, and it's an IgG4 monoclonal antibody that binds to neonatal Fc receptor and decreases this circulating IgG. So it will decrease antibodies, both anti-AChR antibodies as well as anti-MuSK antibodies. So these are two drugs. Rozanolixizumab is again a new drug for chronic immunosuppressive therapy in myasthenia gravis. It might be asked, it is one of its kind, right? Now, before I go to the next drug, let us have a look at an MCQ for the next drug. Which of the following is a new drug approved for treatment of breast cancer with ESR1 mutation? ESR1 is estrogen receptor 1 mutation. Tamoxifen, letrozole, fulvestrant, elacestrant. What do you think is the answer, guys? If you know the answer, let me know in the comment box. If you don't know, it's okay, it's fine. Yeah, the answer is elacestrant. So the reason why I'm doing this session with some MCQs is so that it can give us a fair idea about how an MCQ can be asked, how these new drugs can be pitted against the older drugs, right? So let us have a look at breast cancer. See, HER2 positive breast cancer, drug of choice is trastuzumab. If there is resistance to trastuzumab, then I can use neratinib, I can use lapatinib, I can also use pertuzumab. So how to remember this? HER2 positive. HER2 positive, remember the mnemonic. HER2 positive, 2 nipple penetrating lump. This is a mnemonic here. 2 trastuzumab, HER2 positive, trastuzumab, N for neratinib, P for pembrolizumab, L for lapatinib. So this is treatment of HER2 positive breast cancer. Recently they had asked about lapatinib. ER positive, all of us know that premenopausal I'll use tamoxifen, postmenopausal I'll be using letrozole. In case there is resistance to letrozole, then I can use elacestrant or fulvestrant. Now this is where elacestrant, fulvestrant, they come in. Now what are these drugs? Both these drugs, elacestrant and fulvestrant, these are called as SERD, means what? Selective estrogen receptor downregulator. Means they are only blockers of estrogen receptor. Tamoxifen, it also stimulates estrogen receptor at other places, right? Now, what is elacestrant? Elacestrant is different from fulvestrant. The reason being is the only drug that is effective if there is a ER positive breast cancer with ESR1 or estrogen receptor 1 mutation. That is what they can ask you. So pitting all these drugs against each other, I made an MCQ here. Which of the following is a new drug approved for treatment of breast cancer with ESR1 mutation? Your answer is elacestrant, right? All right. Now, immune checkpoint inhibitors, there is one new drug, retifanlimab. So I've just changed the mnemonic, which I've given you in the revision videos, as well as I've given you this mnemonic, right? Immune checkpoint inhibitors, new rising star drugs acting at immune checkpoint. Nivolumab, retifanlimab, dostarlimab, durvalumab, avelumab, atezolizumab, ipilimumab, semiplimab, pembrolizumab, right? So here, ipilimumab, it's a CTLA4 blocker. Durvalumab, avelumab, atezolizumab, these are PDL1 blocker, programmed delta cell ligand 1 blocker. Everything else is PD1 blocker. Right, PD1 blocker. All right. Now see, there are tons of uses. If I combine all the uses of these drugs, it will come to around 50 uses. I cannot remember everything, so at least remember some uses of these drugs. For example, nivolumab and pembrolizumab, these are used in non-small cell lung cancer. Non-small cell lung cancer, it has been asked in your exam. Nivolumab also has been approved or used in Hodgkin's lymphoma. This is another use which has been asked. Pembrolizumab, they've asked you one use, it's uterine cancer. They have asked you. What else they can ask you? What is the current drug of choice for renal cell cancer? Your answer would be pembrolizumab. So it's okay, it's fine not to remember everything. The immune checkpoint inhibitors, their population, it has grown so much in a short span of time, and it's really difficult to remember all of them. At least remember this much, right? Next new drug, guys, anemia of CRF. It is related to anemia of CRF. If the patient is on dialysis or not on dialysis, if the patient is on dialysis or not on dialysis, does not matter. My drug of choice is always darbepoetin. But if the patient is on dialysis, on darbepoetin, and if the patient is not responding, in that case, a new drug has been approved. It is called as daprodustat. And daprodustat, it blocks hypoxia inducible factor prolyl hydroxylase. It increases transcription of erythropoietin, right? So daprodustat is a drug which is not yet available in India, but it has also been approved in 2023. It might be asked in your exam. right? So daprodustat. All right. Before moving to the next drug, we'll have a look at an MCQ. Which of the following statement is false regarding Vono-Prasan? Right? Which of the following statement is false regarding Vono-Prasan? Taken 30 minutes before food. It is a potassium competitive acid blocker, reversible blocker used in H. pylori. So what do you think is the answer? I think this you can try to answer this MCQ, right? It's not a difficult one. Now here, see, if you don't know the answer, it's okay, it's fine. Option A is the right answer, taken 30 minutes before food, because this is usually what we do for PPI, isn't it? PPIs are something we need to give 30 minutes before food, but not these. See, what is the difference here? See, PPI, if I compare, so I have to pit Vono-Prasan against PPI. PPI, they bind irreversibly to the proton pumps and by disulfide bonds, and their binding is irreversible. They need to be activated by acid in the parietal cells in the stomach, and that is the reason why they can block only food-induced acid secretion, because food-induced acid secretion, that acid activates proton pump inhibitors and then they block proton pumps. But Vono-Prasan is different, right? Number one, it competes with potassium for the proton pump and binds reversibly. It's a reversible blocker. Second, it can block both food-induced as well as basal acid secretion. And that is the reason why it is a faster acting or faster acid suppression is seen, and it is more effective than PPI, right? So PPI, they need to be taken 30 minutes before food. For that reason, I can take them even with food. You can take them before food, with food, after food, whatever you desire, you can do that with Vono-Prasan. And Vono-Prasan has been approved for treatment of H. pylori along with amoxicillin and clarithromycin. So it is not available separately, it is available as a pack along with amoxicillin, clarithromycin for treatment of H. pylori, Vono-Prasan. Right, so this is another new drug which I think sooner or later they can ask you. All right. Coming to the next MCQ, which of the following drug blocks synthesis of PCSK9? So again, based upon a new drug, I have made an MCQ here. You can try to have a go at this MCQ and see if you get the answer right. Option A, evolocumab, B, estemide, C, bempedoic acid, D, inclisiran. Now I know if many of you go for answer A here, answer A would be wrong, right? Evolocumab is a blocker of PCSK9. It is not a blocker of synthesis of PCSK9. Here you would have lost the battle to English language, right? Mind it. So let us look. PCSK9 inhibitors, these are evolocumab and alirocumab. PCSK9 synthesis inhibitor, it is inclisiran. So what is inclisiran? See, you can see SIR. SIR is small I for interfering RNA. Right, it is a small interfering RNA which antagonizes AN. It antagonizes synthesis of PCSK9. So it blocks synthesis of PCSK9. See, I can directly block PCSK9 by evolocumab, alirocumab. I can block synthesis of PCSK9 by giving a drug like inclisiran. Cholesterol, like similarly, with lines of that, cholesterol synthesis inhibitors are statins and bempedoic acid, whereas cholesterol absorption inhibitor is estemide. Now, so that, see, these wordplay, they will happen in your exam. You should not get swayed away by these wordplays. English language should be the last thing because of which you should lose 1 mark, right? Anyways, all right, guys, so coming to the last new drug for this session, Rho kinase inhibitors, fasudil, netarsudil, belumosudil. In 2023, a new drug has been approved, belumosudil, for chronic GvHD, graft versus host disease, which has failed to at least 2 lines of therapy. So at least 2 lines of therapy have not worked, then I go for belumosudil. Let me recap the 2 other drugs in Rho kinase inhibitors, fasudil for stable angina, netarsudil, open angle glaucoma. It increases trabecular outflow. This has been asked recently. Last year only it was asked. So that's all in this session, guys, and all the very best for the upcoming INI-CET exam. And I hope these new drugs, a half-an-hour session that I did, crisp and short for your preparation, is going to help you guys in the INI-CET exam. And do one thing, whatever new drugs you got, whatever new information you got, just add them to a separate page, write them down in a separate page, paste it on the wall so that you can frequently revise them. Right, guys? So I have done my best, whatever I could do for you guys. I've taught you in Marrow. I've given you the new drugs for the INI-CET. Now, see, the ball is in your court, and how are you going to use all this information in the exam is entirely up to you, right? My prayers are with you, and all the best, guys. Take care. Lots of love and blessings. This is Dr. Ranjan with you.